Good morning, students. I, Dr. Sadika Gautam, welcome you all in today's session of Logbook 2 of Diploma in Hospital and Healthcare Management program. On your request, we are conducting this session prior at the as the submission timeline is far away, like it is in the month of February. Okay, so I hope you already have started preparing Logbook 1. So we'll talk about Logbook 2 today. Okay, so as you are already aware, Logbook 2 is a practical training course. Okay, so we will not conduct any exam for this course. Okay, this is a practical course, so there will be only submissions which you have to prepare after visiting the hospitals. Okay, as discussed earlier, you have to select a minimum 50 bedded hospital and you have to do observations according to the submissions. Like logbook 1, there is a different guidelines are there to prepare logbook 1. For logbook 2, there is a different guidelines are there. Okay, so based on these guidelines, we have to prepare logbook 1, 2, and 3. Logbook 1 and 2 is a continuous assessment. Okay, which is 30 marks and 40 marks. So today we'll talk about logbook 2, which carries 40 marks. Under this logbook 2, there are two separate headings are there: hospital infection control and biomedical engineering department. Under these two headings, we have to prepare the logbook 2. Okay. And as you are aware, logbook 2, 3 will be considered as your term and submission. Okay. We won't be conducting any exam for logbook course. Logbook 3 will be your considered as a term and assessment. Okay, so it is a department specific report. We will conduct this session in the month of January. Okay, and the submission timeline for that is the 15th of April. So by the time you will be visiting campus for contact session, that time most of you will be done with your logbook 3 report also. So let's talk about logbook 2. So under logbook 2 heading, you have to prepare you have to study two aspects of the hospital. One is the infection control and second is the biomedical engineering department. So under infection control heading, these are the parameters which you have to observe in the hospital. So you will look for hospital acquired infection surveillance. Okay, so you will see like what are the policies are available in the hospital regarding HAI. Okay, so hospital HAI, we also name it as a hospital associated infection. Okay. So also about hand hygiene, about personal protective equipments, because personal protective equipments have geared more importance from the corona time, right? Post COVID, we are more practicing wearing PPE case. Okay. Next is the spill management. Next is the antibiotic policy and infection control committee. Okay. So under infection control heading, which carries 20 marks, you have to observe these six headings. Yes, six headings, and you will prepare report based on that. Okay. And you have to see like what is practiced in your hospital where you are planning to conduct logbook. Okay. So as you are already aware that like what is hospital acquired infection? Hospital acquired infection is also called as a nosocomial infection, which can be defined as an infection acquired in a hospital by a patient who was admitted for a different reason other than that infection. Okay. An infection occurring in a patient in whom the infection was not present at the time of admission or it is not incubating at the time of admission but presents while patient is in hospital or in other healthcare facility. Okay. So, why surveillance is more important? Okay, these are the purpose of surveillance. Okay, surveillance, what do you mean by surveillance? Surveillance is a dynamic, ongoing, systematic collection, analysis, and interpretation and dissemination of data regarding a specific health-related event for use in a public health action to reduce morbidity, mortality, and to improve health of that particular specific population. Okay, so for that reason, it is required to do surveillance. Okay, so it has been established in developed countries that surveillance of HAIs raises the awareness, improves care, and ensure patient safety. However, this is only possible when surveillance and infection prevention is accepted as an important aspect of that particular hospital safety policy. Okay, so what are the purposes of HAI? Why we supposed to do the HAI surveillance? So it is just to reduce the HAI frequency, okay, to reinforce the practices and procedure, to assess the impact of prevention and control measures, establishing baseline rates, and if at all there is a case law against that particular doctor or particular hospital, so you may able to produce certain documents and evidences. Okay, for that reason, purpose of this is the purpose of like doing surveillance. Okay, so next is a infection control committee. As you are already aware, every hospital has laid down some infection control policies, and there is a designated infection control committee. Like you have to see in the hospital wherever you are planning to do your logbook, you have to ask to them like who all are the members of that hospital infection control committee. What are their roles and responsibilities? Okay, is there any infection control manual is prepared? Okay, and what are the rules and regulation to conduct of that particular meeting? The committee should have a wide representation from all the relevant disciplines. Means he should be from the matron will be part of that microbiology department personnel or microbiologist like physician, surgeon, hospital administrator, pharmacist, and representative from the CSNG department and housekeeping and maintenance. So all these members forms the part of the infection control committee. And what are the regulations and the rules for that particular committee? How frequently they should meet, like how to prepare the report and how the action plan to be prepared. So you have to observe, you have to go through those manuals in the hospital. Next is a hand hygiene. So as you are already aware that normal human skin is colonized with the bacteria, which we call it the normal flora. And hands of the healthcare personnel are become persistently colonized with the different types of bacteria, gram negative bacilli or yeast or any pathogenic flora, right? So one of the most important measure to prevent the hospital infection control is a hand hygiene. So you have to see whenever you are planning to visit the hospital, you have to see like the hand hygiene is practiced in that particular hospital or not. Whether the every wash basin area is labelized and the images of that particular hand hygiene practices is posted or not. Also, you have to see like how frequently the training is being conducted for the healthcare personnel. Okay. This image is taken from CDC website. Okay, so this is the hand hygiene image, like how to do like steps of the hand hygiene. So whether it is available in your visiting hospital or not, you have to observe that. And how frequently they are training, training is provided to those healthcare personnel. Next is personal protective equipment. As per Occupational Safety and Health Administration, the definition of the personal protective equipment is specialized clothing or equipment worn by an employee for protection against the infectious material. So you have to see like when they are using personal protective equipment, like is the staff is uh, trained to wear the personal protective equipment, right? So donning, doffing, they are aware like how to dispose of that particular personal protective equipment after its usage. So they are trained or not. And the display of processes also they have to look for it. Okay, so under personal protective equipment, you have to see the sequence of wearing and removing, training of the staff, and the display of processes. So next is a spill management. So why spill management is important? Like, and what kind of spill is considered as a small spill, large spill? Are there any guidelines given in your particular hospital or not? So you have to look for it. This is mainly to minimize the spread of infection among the patient and the healthcare professional. So you have to see like and how the spills are managed once it has happened, like how they are managing that particular situation. So what kind of disinfectant they are using, like, and what proportion they are using. So you have to ask for that also in your hospital. Is there any manual available regarding spill management? You have to ask in that particular hospital. And next is the antibiotic policy. As you are aware, antimicrobial resistance is uh, more and more happening in the developing and the developed countries, and this mainly because of like people are taking the over-the-counter drug and they are not completing that particular dose, and in between they are leaving the medicine and they are not completing their entire dose. These are the reasons where antimicrobial resistance have increased. But what exactly antimicrobial resistance means? As per WHO, the antimicrobial resistance as the resistance of the microorganism to an antimicrobial drug that was once able to treat an infection by that microorganism. Okay, so once that medicine or drug was able to treat that particular drug, but now that drug, that particular bacteria or microorganism is become resistant to that particular drug. Okay, so who can we can involve who to reduce or minimize this antimicrobial resistance? How we can tackle that situation? For that reason, people in general, like people like us who are not visiting doctor and taking over the counter drug and not completing that particular dose, and they are taking for even the viral infection, they are taking the antibiotics, right? So that way you have to see like who can help us to minimize this. We can create awareness among the people, healthcare workers and the pharmacists, those who are dispensing medicine in the pharmacy, right? They should at least convey this message to the general population. Yes, policymakers and the regulatory authorities and the industries. They can really make a difference by minimizing the selling of such drugs over the counter. We have to ask in your hospital like whether they have an antimicrobial policy or not, and what is written in that policy, like how it is to be done. Okay, so by this time we talked about the hospital infection control. Okay, under hospital infection control, uh, like these are the things which you have to observe in a particular hospital. So first is you have to check for like what is the HAI rate in that particular hospital, like how they are doing surveillance to minimize this, right? Then about hand hygiene. Is there any infection control, quality control committee or infection control committee is established in the hospital or not, right? Then you will look for like PPE kits, like whether the staffs are trained or not, like everywhere the posters are placed, like how to do wearing and removing of the PPE kit. Okay, and then about antimicrobial policy, how it is practiced in that particular hospital. Okay, so till the time we talked about 20 marks of the logbook, which is a part one. Okay, so next is a biomedical engineering department. So biomedical engineering department is the application of engineering principles and design concepts to medicine and the biology for healthcare purpose. This field seeks to close the gap between the engineering and the healthcare and the medical field. Okay. It combines the design and problem solving skills of the engineering with medical and biological sciences to advance healthcare treatment, including diagnosis, monitoring, and therapy. Okay, so under this biomedical engineering heading, we will be observing about the planning and installation of biomedical equipment, repair and maintenance, calibration of devices, and the equipment audit. You have to visit biomedical engineering department of your hospital. Okay, so first we'll talk about the planning and installation of biomedical equipment. Under this heading, uh, we will talk about the inventory and documentation, commissioning and acceptance, monitoring of use and performance, and maintenance of the equipment. So under planning and installation, initially we need to see need assessment, whether do we really need that particular equipment or not. Yes, once it is approved that we need that particular equipment, right? Then we go for bidding, then the finance officer, they will raise ask for the quotation, the vendor will share with then bidding will done, and the lowest rate and the best quality vendor will be selected based on the uh, market analysis or the comparison between the other vendors. Okay, so regarding inventory and documentation, commissioning and acceptance, what are the tasks to be performed at the hospital? Inventory and documentation. The inventory of the medical equipment should be maintained department-wise at store level for the equipment. Also check for the maintenance and contract of the insurance. Very important, you have to check for the documentation. It will include the contract and the insurance of that particular equipment. Commissioning means the competent authority should ensure that installation and commissioning of the equipment by the manufacturer and supplier. The process should be monitored by the in-house technical staff. The installation of that particular equipment will be done in front of the technical person of that particular hospital. He has to monitor, he has to be there throughout the installation process because he is the person who is going to work on that particular equipment. So technical staff should be there. He has to note down and record all the event happening during the installation of that particular in the record register. Okay. This also provide excellent opportunity for the in-house staff to learn about and know more about the particular equipment. And commissioning means like the first usage of that particular machine. Okay, you have to also see like you have to do few scan or the few investigation in front of the particular technical person or the vendor or the person who is installing that particular machine. Okay, monitoring of use and performance. It is important that user should make a safe use of the equipment and he has to continuously monitor the performance of that particular equipment. Many equipment will require daily, weekly inspection. Few of the equipments may not require daily maintenance. There are like guidelines will be given in that particular user manual or the technical document where like how frequently the maintenance will be required for that particular equipment or machine and maintenance of the equipment. And the maintenance of the equipment shall include mainly two headings, which is like planned preventive maintenance and breakdown maintenance. So there are two types of maintenance under the equipment maintenance. Okay, maintenance of the equipment. Proper maintenance of medical equipment is essential to obtain sustained benefits and to preserve capital investment because it is a huge investment made by that particular hospital. So planned maintenance involves maintenance performed to extend the life of that particular equipment and prevents its failure when it is in a service. Okay. So planned maintenance is decided like when we have a frequently just now we talked about like how frequently the maintenance is required to that particular equipment. It is based on that like so that particular equipment will not be out of service. It is in a continuous service of the community. And this planned maintenance is usually scheduled at a specific interval. The procedure and the intervals are usually established by the manufacturer. You have to record how frequently it is being maintenance is done, and you have to record and document everything into the maintenance register of that particular document. And next is a breakdown maintenance. Breakdown maintenance is considered as a huge loss to that particular hospital. Once the particular equipment is not in a service, means it is not providing services to the patient. So financially, it is a huge loss to that particular hospital. It is a task performed to identify, isolate, and rectify a fault so that out of order equipment machine can be restored to an operational condition. All medical equipment is used in use should be free from any fault or defect because as the human life is involved in that. Okay. And the repair work should be carried out to a acceptable standard because uh, it is giving us the records of that particular health record of that particular person and the patient. All the breakdown occurring in the department should be maintained and to be recorded and documented, and it is to be notified to the higher authorities of that particular hospital. Okay, so you have to observe in that hospital, like how biomedical engineering department is functioning, like how frequently they are doing the maintenance. Because there is a separate department in the hospital, usually functioning for the biomedical equipment. Okay, and how frequently, like how they have a insurance plan, how the contract is been renewed, and how the technical document is reviewed by that particular technical person. So you have to ask for like the plant maintenance and the breakdown maintenance to that particular hospital. You will also, you should also request them to show that particular audit register or the maintenance register, like how they are maintaining these records in their register. After followed by the maintenance, equipment audit also plays an important role in biomedical engineering department. So there is a separate committee is established in the hospital to conduct this audit, equipment audit committee. So what exactly equipment audit does? Equipment audit, it is a periodic evaluation of the systems to measure the quality of that particular equipment, which is providing services to the patient and to check the performance of that particular medical equipment. So there are guidelines are given to form the equipment audit committee and who can be member of that particular equipment audit committee. Usually the medical superintendent, the head of that particular department, representative from the admin group, mean the administrator of that particular hospital, and representative from the finance department, nursing superintendent, and hospital store in charge. Because these all people involved in the purchase of the equipment audit committee. So these people should be a part of equipment audit committee. And different like the different dates are the interval are decided by that particular hospital to conduct the equipment audit. So in the equipment audit, along with the maintenance, calibration also plays an important role. Calibration of the devices. So what calibration will do? So it is calibration is usually carried out to minimize the uncertainty in the measurements with a view to minimize the errors, and it should give the measurements at the acceptable level. So with the repeated use, there is a wear and tear of the devices, right? So there are guidelines are also given by the FDA, like how the equipment and what kind of equipment like to be calibrated. So there is a separate technical document is also available. So you have to ask that particular hospital like how they are doing the calibration of that particular equipment and how they are documenting. If at all there is any error, like how they are rectifying that error, and between those time, if at all there is a breakdown of that particular equipment or instrument, like there is a out of order of that particular equipment or the service in the hospital. So in that situation, how they are managing that situation? If like there is a 50 of OPD is there for investigation of USG, and immediately there is a breakdown of the USG machine. Like 50 patients, 50 patients is a huge crowd, right? So how they are managing that situation? Like they are sending them to the nearby hospital, or like they have alternate USG machine. So how such situation is handled in that particular hospital? So you should ask such kind of question. Okay, so in till now we have completed the next 20 marks of the logbook 2. So logbook 2 has two components. Just now we talked about the biomedical engineering department, and first is like hospital infection control. So under biomedical engineering department, we talked about like the purchase of the installation of that particular equipment, commissioning and acceptance. Later we talked about the maintenance, calibration, and then the equipment audit. So under these heading, you have to do the observations for the logbook. So that's all related to logbook 2 submission. As you are already aware, how to do the submission of logbook 2 in the elements. Logbook 1, logbook 2, you have to prepare the file and you have to upload back to the elements. Okay, if you have any query, you may ask. You may unmute yourself or you may write your query in the chat box.
Ma'am, I'm Nihar Desai, and I would like to ask if hospital has no particular policies like regarding maintenance of the equipment, biomedical equipment, or policies like infection control. They don't have committees for such things. Then what we
Uh,
are supposed to write? Whether we are supposed to write that there is no committee as such?
no, but it won't be possible that like that hospital may not be having the biomedical engineering department or the quality control department.
Yeah,
I
they
don't
do
think
have.
so.
Yeah, many hospitals they do have. Few hospitals I
Right.
have seen that they don't have such policies documented, written or documented.
So
They just
whenever
do
like
the thing,
you
but
have
they
to,
don't have. Yeah,
okay. In such scenario, you have to approach me because I need to know, because I guess around like 95% hospital must be having uh, the quality infection control department, right? And the
yeah,
biomedical, because many hospitals must be having, as the instrument and equipments are required by the hospital. For that reason only we requested student to select minimum 50 bedded hospital. Okay, if at all you are finding that like you are not able to get that particular hospital, you send me one email. I'll speak with that particular student, like how we can do it. Like I need to know like which hospital they have selected. Like these policies are not available in that hospital. Okay,
okay.
you may write to
Like
me, Arjun.
yes, and audit book. You said about audit book, ma'am. That
Hmm.
the audit
Audit.
book we need to go through the audit book and all. If they are hesitant to show us the audit book and
Okay, no
all,
issue. You have to write in your report. Like we requested to go through that particular audit book or the maintenance register. Sometimes hospital may deny, so you have to mention in your report. We
yeah,
have requested, but the request was denied by that particular hospital. No issue.
yeah. Thank you, ma'am.
Okay.
Yes, ma'am, this might happen.